I'm Debbie McManus, Director of the Early Education and Support Division. Welcome to the California Department of Education Child Care and Development Fund State Plan Topical Public Input Session. I want to thank the 9 regional county offices of education and superintendents for hosting these public input sessions. This way we're able to get solicit input from across California. Public input is an important part of the process, and we here at CDE appreciate you taking the time to share your comments with us. There will be opportunities to provide other input that will be shared throughout the presentation. And so I would like to turn it over to Marguerite and the Policy Office and thank them for all of their hard work and efforts.
Good morning, everyone. We want to begin with some thank yous. We want to thank in particular CCDAA, the California Child Development Administrators Association, for helping us secure many of the satellite hosts today. And we'd also like to thank the satellite hosts themselves for giving up their time and letting us use their space locally. It's something they volunteered to do, so we're very grateful. And then finally, we'd like to thank the participants and commenters who have come today to provide input or listen to the input for the state plan. So we have a little bit of a process this morning. I'll go through some timelines that the state plans to implement for the reauthorization of the Child Care and Development Fund and Child Care and Development Block Grant. I'll also share some relevant state and federal laws to the conversation, as well as outline some areas that we'd like to receive specific input. While I'm giving that introductory information, I'd like to ask that the satellite host please survey and ask the people in the room with them who would like to provide public comment. We know not everybody in the room wants to provide comment. A lot of folks may just be listening today, and that's fine. But please take a head count so we can decide how many people are come in the order that we want to provide that input. We would like to go in alphabetical order of folks in the satellite site, so as soon as you can, please send us that information. If any of the satellite sites have any questions, please type them into the chat box, and please remember to keep your phones on mute until we call your office to provide comment. When your location is called, we ask that the satellite host please type the name of each presenter into the chat box so we can have a good record of who was here today. And then the CDE will announce each speaker so they may present their comments. Please be aware today that this session is being recorded and it will also be transcribed. Both the recording and the transcription will be posted on the CDE website. And if you brought written comments today, your satellite hosts are not responsible for collecting that information. We want to make sure it gets to the CDE, so please email your comments to the email address you see on the screen. It's stateplan@cde.ca.gov, and please note that there is no A in plan. We welcome public input at any time. Today, we're certainly glad you're here, but if you'd like to provide written comments, you may send them to us by mail, by email, and by fax. This information is all on our website, so you don't need to write it down quickly today. Just go to the CD website and you can find these other opportunities for input. So the Child Care and Development Fund is our primary source of federal funding for subsidized preschool and child care in California. And the Department of Education is the lead agency charged to administer the CCDF fund in California. The CCDF has several goals, and those include to increase the availability, affordability, and quality of child care services, to improve child care and development of participating children, and to improve the number and percentage of low-income families in high-quality settings. There are a number of steps that the CDE, as the lead agency, needs to take in order to prepare and submit the state plan. And the state plan is really how we tell the federal government how the state is going to spend the fund and implement activities. And so the Child Care and Development Block Grant and Child Care and Development Fund were reauthorized at the federal level. Actually, before this timeline that starts here, it was reauthorized in November of 2014. And so the CDE last January hosted a public hearing, excuse me, and in late January of last year, the preprint or the template that is provided by the federal government of the actual plan was made available for the first time, but it was a draft. In February of last year, the CDE hosted topical input sessions, much like we're doing today, but they were located in Sacramento last time. Today, we work to have those satellite locations to hopefully increase options for input and not just limit it to Sacramento. And we will share today some of those notes from the topical sessions last February as they relate to license-exempt monitoring. In June, the revised preprint was made available for public comment, so that was the second version we've seen. And in July, the public comment period closed. In September, another version of the preprint was made available for public comment, and CDE will post a link, it's actually already there, a link to the second version of the preprint and how you may submit comments and when those comments are due if you would like to do so. So here we are today on October 8th. We're having a second round of public input sessions. In December, the CDE will post the first draft of the state plan. The draft has not been written yet, and that is because we are waiting to receive public input. Much of it will come today from the topical sessions, but we will post it in December to gather that input. Please also note that the federal government has indicated that the final version of the preprint will likely be available in December, and so the template that's online right now may change slightly. And also in December, we anticipate that the federal government will release the first draft of regulations to implement the Child Care and Development Block Grant. So the reauthorization that happened in November of 2014 changed the CCDBG law, and there are no new regulations to support the reauthorization of that law. And so the Office of Child Care at the federal level has indicated to us that they will be promulgating regulations in December, but those will be a draft, and so it is unclear at this time when that draft will be finalized. In January of next year, the CDE will submit a draft to the legislature and the Department of Finance. On January 12th, the CDE will host an additional public hearing, and we will use a similar format to that of today where we will have satellite locations across the state again, so hopefully we can solicit greater input and folks won't necessarily have to travel to Sacramento. On March 1st, the state plan is due to the federal government and the Office of Child Care. And then if all goes according to plan, the state plan will be approved and implemented in June of 2016. The CDE, so the federal law has changed, and there are many things both in state law and state regulation that will need to change in order for CDE to implement what the federal law has to say. But because we do not have the final regulations yet, the CDE absolutely plans to promulgate regulations in order to make us compliant, but we will not announce or promulgate those regulations until we have the final regulations from the federal government. We want to make sure that we clearly understand the direction the federal government wants to go and have clear guidance before we issue our first draft of regulatory changes, for many reasons, but primarily because we don't want to have to change state law or regulation twice. We want to make sure we clearly understand where the federal government would like to go. Okay, so today for this session we are here to talk about license-exempt monitoring, and this is one piece of the federal law, and you'll see the citation at the bottom of the change that all states will need to implement. So if a state uses funds received under the subchapter to support a child care provider that is exempt from the corresponding license requirements described in Clause I, the plan shall include a description stating why each licensing exemption does not endanger the health, safety, or development of children who receive services from child care providers who are exempt from such requirements. We can go to the next slide, and there's more in a different section. The federal law requires that licensing inspectors of child care providers and facilities perform an annual inspection of each license-exempt provider in the state receiving funds under the subchapter, so CCDBG funds, for compliance with health, safety, and fire standards at a time to be determined by the state. So we held a topical input session in February of last year on this topic, and we wanted to provide a really brief summary of what some of the comments were that were provided on that day. There is an existing group called the Health and Safety Regulatory Work Group that historically has provided information to the Department of Social Services and Community Care Licensing. So the CDE, in partnership with the Department of Social Services, is working closely with the Health and Safety Work Group to utilize what they're always doing and solicit additional input. Another comment was that the field needs resources in order to implement the new law. License-exempt providers just don't have time to attend training. There was a suggestion to build upon the Los Angeles County Disaster Preparedness Plan, which is part of the health and safety changes included in the reauthorization. And then it was also very important to those that attended in February to have access to trainings for non-English speakers. So there are two types of input we would like today, in addition to anything you may also have brought. When you think about license-exempt monitoring, there will have to be somebody that does it at the state level. So my next slide will cover that, but we also want information about what the visit will look like. Some of the feedback we've received thus far has really been that the field would like to see a home visiting model. And then another suggestion has been to combine the license-exempt monitoring visit with other inspections. So we know that many of our contractors and providers receive many visits throughout the year, maybe to do their quality rating or their environmental rating scale or a nutrition visit or some sort of audit. So is there a way that the license-exempt providers could be monitored in a way that the other folks that are coming to visit maybe could have other responsibilities and maybe do the visit throughout the year or have it be combined with other inspections? Just an idea, curious about your thoughts. And then in terms of the agency or the person that would come and actually do the license-exempt monitoring, these are really just some options. We want to know the pros and concerns with some of these options. Trust me that no decisions have been made. As I stated earlier, the state plan hasn't been written yet because we're waiting to see what type of input we receive and what is really important to the field. So just some options that could be considered for who would do the license-exempt visit. It could be the California Department of Social Services Community Care Licensing Division, which I think, as everyone knows, does most of the license monitoring currently. It could be the California Department of Education. It could be through the local alternative payment programs. It could be through local resource and referral agencies. It could be through a newly created state agency that this is their sole responsibility. Or frankly, it could be something that isn't on this slide that we haven't thought of. So we'd really appreciate your specific comments related to who you would like to do the visit itself. So again, I just want to remind folks that there are many opportunities for public input. They're listed here. They're also on our website. We appreciate and seriously consider all of the input we receive. So now we want to turn it over to hear your input and why we're all here today. So if you haven't already, please in your chat box let us know who would like to provide comments, and we'll just go ahead and get started. We'll actually start with San Diego County Office of Education, and the first name I see listed is Julie Lowen. Go ahead, Judy, and provide your comments.
Okay, you got to us quick, so I'm getting her the mic. Thank you so much. I'd like to raise a couple of issues when it comes to license-exempt. Many of us have a lot of experience working with license-exempt providers, and the quality that we see during visits as we are working with some of the children that are in these homes is incredibly poor. So I think that the argument we don't have time to attend training is not probably something that I would say should be considered. Taxpayers are only willing to pay for services if those services in fact are high quality, and that high quality once again brings the child to the forefront of the decisions that we're making. When it comes to an exempt provider, is the quality care in the best interest of that child? Sometimes it's the most convenient for parents, but are we really interested in funding convenience for parents? Or as a community, are we deciding that we are going to transition from this convenience for parents system to a system that in fact puts the child at the center of everything that we're doing? The quality rating improvement system is here. I don't see any reason that we need a new agency or need to define new programs. What we need to be doing is building upon the programs that exist in the state of California. I hear a lot about, well, it's not in every county, but it is in a lot of counties, and that's better than anything else we have. So ultimately creating a new state agency or doing all of these, big, fabulous new things, or funding community care licensing when the quality of monitoring provided at this time by community care licensing, I would say, is marginal at best, is probably not the way that this, in my opinion, the way that the state should go. I believe that the state of California is best served by building upon the resources, by building upon the money that we've already spent to create these high-quality networks. We have a network in San Diego, and I would say that for my input, I believe that an early care and education consortium that starts to bring in licensed exempt providers, but only those who are willing to, in fact, provide quality for the children in their care, if they are willing to connect to provide quality, and then through that consortium also receive monitoring annually that would meet these regulations, then that's something that our state should support. But I don't believe that we should be applying for an exemption from this, and I don't believe that we should be funding community care licensing to do a job that is ultimately best left in the hands of home visiting and the Early Care and Education Consortium.
Thank you, Julie. Next on my list, I have Rick Richardson.
Good morning. My name is Rick Richardson with Child Development Associates, President and CEO. I'd like to echo the previous speaker's comments. As the state develops the implementing regulations and resources for which entity will conduct the license-exempt monitoring depicted on slide number 8, I ask that the state consider the following. Allow the counties the flexibility to determine who would conduct such inspections, allowing the counties to take advantage of existing networks and systems to meet the requirement and also connect to the existing network of support and quality improvement resources. Examples include resource and referral, alternative payment programs, licensed providers, CSPP providers, county-specific QRES efforts, or consortia. These networks often already have working relationships with the license-exempt providers, and these networks may be able to scale up existing efforts at a reduced cost instead of a new program or a new agency. And finally, licensing agencies may not be the most effective or efficient means to fulfill this requirement. Thank you.
Thank you. Next, Kim McDargle.
Hi, this is Kim McDougall from the YMCA Child Care Resource Service, and I would just like to say that, I think we can all agree that protecting the health, safety, and development of all of our children in license-exempt settings is extremely important and something we do need to work on. But I believe that the licensing regulations are really currently a bare minimum in terms of setting quality standards, and we should go above and beyond this minimum level of quality to provide a higher level of support for the license-exempt providers, including additional training and coaching support on site.
Thank you, Kim. Anyone else from San Diego County Office of Education?
Yes, this is Lucia Garay from San Diego County Office of Education. And I wanted to make 2 points. They echo some of my colleagues here. The first one is regarding the license exempt and the fact that we do have a need for it for our infants. We do have a need for it for non-traditional hours. And my recommendation is to limit the exempt care to, for example, infants under 18 months and or for use during non-traditional hours. And then to add to what Kim McDougall was stating, really have a checklist or something at the state level that is adopted that is a step higher than our current minimal licensing reviews. And I agree again with what was stated by Rick Richardson and Julie Lowen regarding the availability at each region and have local decisions about the entities, the partnerships, and the resources that we have, possibly using systems that we already have in place, like the RFP processes for AB 212 with our local planning councils, and have something that can be locally decided. We are all working much more collaboratively these days, And I wish that we could really take that to a local level, being as diverse as we are across the state. Thank you.
Thank you. Anyone else from San Diego?
No, thank you.
Thank you. Okay, I'll move next to Marin County Office of Education. I have one person listed, Angie Garling. Go ahead, Angie.
Sorry. Okay.
Type in your name.
Yeah, you did, though.
You can mention your name and then type after.
Okay. Yeah. I'll go ahead and type in my name in a second. This is Domenica Benitez with the California Child Care Resource and Referral Network. Now, if I can do that all at the same time, that would be the phone. So to comment on the license-exempt monitoring, I wanted to first start on what we know and what we've learned about license-exempt providers. We know from several studies that that they are motivated by helping their friend or family member, loved one, and professional development. They are interested in health and safety, nutrition, and 74% have reported that they're interested in learning more about child development and receiving information through workshops. We also know that they do carry some of the indicators of quality, which can be the continuity of care, the support of home-based language and culture, and also oftentimes low ratios as well. So we know that there are some areas for improvement, but we want to start with the strengths that they also bring to the table. We certainly want to recommend that we build on existing infrastructure to with the continuum of all home-based providers to ensure that programs like the California Child Care Initiative Project that are built into all of the resource and referral programs help to connect license-exempt providers to licensure if they're interested in that. We know that the R&Rs are also trained in health and safety, and they'll also be trained in the additional 14 hours that will be required as part of the 30 hours of training requirement. So that'll be an additional connect that they'll have with the license-exempt providers. We feel that the visits, the monitoring visits should be supportive. I think a home visiting model could be something that works. We think it could be based on a self-assessment kit that is similar or a modified version of the key indicators toolkit that's used by licensing. However, we do feel that it's critical that it be a supportive visit, that time is invested in helping to engage them in the ECE community so that if they are interested in licensure, they can make that bridge fairly seamlessly, that they're receiving support in the languages that they understand and learn best in, and we know that the R&Rs are equipped to provide this. We also want to build on the lessons that we've learned, like the Informal Care Training Project, or otherwise known as the Growing, Learning, Caring Project, which all the R&Rs implemented in 72 local sites from 2005 to 2011, and many of the R&Rs continue to provide outreach, training, and support to providers. When they implemented the project, they were all also trained on the Parents as Teachers home visiting program specifically for family, friend, and neighbors. So we feel that that's also an additional tool that we can build to their repertoire. And the network will also be rolling out the evidence-based Kaleidoscope Play and Learn model in California to support R&Rs in growing in this way and also providing additional support to FFNs. I think that was pretty much it. So, and we'll submit our additional information in writing.
Thank you, Domenica. I have two names, and you can go in either order, Angie Garling or Michelle Rutherford. Oh, and Anna Levine.
I'll go. All right. Angie's last. I hope I can channel her. So we actually had a bit of a robust conversation here in the break time before this session, and this is a really interesting issue for us. And I think in general, locally, and what I'm hearing from some of our colleagues is this concern about what is the purpose of the visit, and folks want the purpose to be different perhaps from what the federal intent is, which the federal intent is an inspection, right? And we're saying if we're going to go out and see license-exempt providers, we would like it to be supportive, engaging, and have something to connect them to. So, and in terms of what the state is has laid out in terms of some options. I really appreciate you thinking through, like, what the possibilities are to allow us to respond to, because I do think that that's exactly what you're up against in terms of thinking through those choices. There's no getting around. It's going to be more cost-effective to have our nonprofit partners who are closer to the ground and closer to this, our license-exempt providers do this work. The R&Rs have a long history of doing this, way before this issue came up, thinking through how we can capitalize on the connections that the APs already have with license-exempt providers. These are the same providers that are being fingerprint cleared. These are the same, because we're not talking about relatives as I understand it. We're talking about the license-exempt providers that are non-relatives. So a concern that we would have is investing a lot in license-exempt providers who have a rapid turnover, and that's not a good use of the state's effort. If the federal requirement is annual, then we should be careful about not moving beyond, closer in beyond that in terms of having time to go out and outreach to providers. Everybody might think that's a good idea, but considering the competing needs and pressures in the system right now and how underfunded we are on rates and some other factors, that wouldn't be the priority. Similarly, the state doesn't currently have an infrastructure for QRIS, really, and isn't adequately funding QRIS. We can't figure out how to move on QRIS fully for licensed care currently. So I would suggest also that framework isn't the best framework for license-exempt providers. License-exempt providers are really quite a different, most of them aren't wanting to be licensed providers. Most of them are doing this for quite different reasons, and we need to be conscious of those reasons. If basic intent needs to be about health and safety, we need to make sure we're finding ways to address that, but then also engaging them for other kinds of system support. I want to speak specifically to a concern in this and in other areas about bifurcating our system for TANF and non-TANF. And as I understand it, the federal requirements may not apply to TANF dollars. It is a huge concern that the temptation, because of cost, of treating then CalWORKs differently, and also because of the push and the need from, I understand from my county welfare department, colleagues, that the pressure of getting folks to work often means families are using license-exempt care at higher rates. So being thoughtful about do TANF children not deserve the same protections that we're thinking about for all children? Are those, what are the safety, if we have safety concerns and those are legitimate, then shouldn't we be treating all license-exempt the same? And I think that's going to be a challenge for us. But similarly, in any other area of what we're implementing, to not bifurcate CalWORKs from non-CalWORKs. I also wanted to comment that given the discussion in the earlier section on the 12-month eligibility, that in fact, if some license-exempt enrollment is being driven by the fact that there's not the allowability for full-time, part-time care, and we could reduce some of the concerns around license-exempt utilization by making sure that those families have access, and also it would offset some of the cost pressures about license-exempt visiting. It also reduces the cost. It reduces some of the current administrative burden on APs who are having to do all kinds of machinations around eligibility and need. that then could be redirected to do license exempt monitoring. So, I think there's a fit in thinking through how we're shifting resources and shifting priorities. And then I would urge us not to overreach on the investment in license exempt. If it's an annual visit, then we really should be keeping to that, what that means to have an annual visit and not move it up to the early stages, because many families use license exempt care as an on-ramp until they can secure a license slot, and I think it is really burdensome for the state to be investing in those care arrangements as opposed to what we're really seeking for kids. Thank you.
Okay, whoever's next from Marin County.
Jason Holta with the Office of Early Education. I'm just going to echo a few things. One, I agree with my colleagues around the state and around my table here that the county should have discretion to utilize and leverage its own systems and county community-based organization partnerships to perform inspections of license-exempt providers. Two, I also agree that we should look beyond just simply doing an inspection with the with the limits that we currently have with our community care licensing, and look to expand that to help connect our license-exempt providers with additional resources to increase the quality of their services to our families and children, particular connections to FRCs and developmental screenings or early interventions, parent engagement strategies, et cetera. I agree with Michelle that we want to ensure that our annual visits are really extended to 12 months and not to have a requirement to perform those any earlier. I think that could be quite onerous to implement if we were, for example, within a parent utilizing a license-exempt provider, if we required them to have that inspection within 30, 60, or 90 days, that might be onerous. And lastly, recognizing that the state views this currently as an unfunded mandate, and I just want to encourage the state not to diminish or limit funding in other important areas of our statewide ECE system to pay for the monitoring requirements. Thank you. We have one additional.
I'm next. Are you?
Yes.
Go ahead. Hi, this is Anna Levine from the Child Care Law Center. I wanted to start just by saying what might be obvious to some, but that license-exempt care is a part of our system that is necessary. There are, whether it's for parents with variable or non-traditional work schedules or kids with disabilities, or whether it is a choice or whether it is because of the lack of licensed care. In 2010, if you look at the Packard Kids data, that's when the data was last available, only 28% of the workforce, children with both parents in the workforce, had licensed care available that met their care needs. So we need to find some way to make this work. It's not enough to say that, as some have said, that we should just steer people towards licensed care. It is a part of the system. We need to find some way to work into the state plan. So there's sort of three kinds of questions. Who does it, the monitoring, what are they looking for, and when are they doing it? And on the when, maybe because it's the easiest, I was just reading the preprint and the statute, again, the federal statute, and I realized that the pre-licensure visit and the once a year are in separate areas, and it appears that, and I would strongly urge that we not make pre-licensure inspection a requirement. It's just not in the nature of license-exempt care, which is informal, which fluctuates, which is often in a pinch for parents coming into the system, to make that a workable strategy. So I would urge that we do not include pre-licensure in this form of care. And then once a year and within the year, it seems like a reasonable framework in terms of investment of resources, because it will take a lot of resources and a lot of doing to do it. What are they looking for? Because that drives who does it. And the law says, health and safety standards. I think that we can broadly interpret that. And I echo comments that this should be incorporated within our systems to build quality, to tie people into resources, to engage families, and not be a simple licensing checklist of do they have a fire alarm, do they have these things which are basic health and safety. But if you're going to do some resources to get people out there, it should be a supportive visit, and it should be aimed at tying families and care providers and folks back into our existing resources. So who does it? And within that, and I would also echo comments. I really appreciate that the work that the Department of Education has done in laying out this issue and talking about the different options that are available. One option that was not up there, which is something to consider, I think if we're going to have a new state agency that does this kind of work, that it shouldn't be an entirely new thing that does just this. So I would just say that to throw out there that there has been a movement in some states towards a sort of an Office of Child Care that combines certain functions of the Department of Education, Department of Social Services around these issues, and that this is something that people might want to consider, but that considering a new state agency that does only monitoring and compliance with license-exempt care does not seem like a good use of resources, and seems like a movement in the wrong direction, and a system that everybody recognizes is overly bifurcated. So among the options that are on the table of existing agencies, I would also say that the family engagement functions, the directing people towards resources, capacity, all those things are currently live in our resource and referral system. And so I think that we need to enlist those resources. If that means, it is true that who knows, the people who have the data and the information in terms of efficiency on who is using license-exempt care and where the providers are, alternative payment programs, those programs, when they stand alone from the resource and referral program, won't have access to the local community data that allows for flexible support. And so I would encourage, where possible, these functions to be combined in an APP R&R program. And I think when I'm thinking across the state, I cannot think of a county where there is not some combined AP R&R, though there are standalone programs in many counties. And in terms of building upon the QRIS system, I think that if we can move in that direction, that is really a good direction to move in, but I recognize also the challenges that we are not there yet on a statewide system, but the law is trying to move us in that direction, and so I would encourage, we are a state that has many resources in terms of technological capacity and ability to coordinate, and that we move towards that system and try to create incentives in terms of what we're doing when we're monitoring, and not just a punishment list. So it's not just that you get cut off. Obviously, if there's a basement of a real, true health and safety concern, then that's flagged. But I would want our whole licensing system to be moving towards correction and support rather than just a checklist that doesn't give anybody an option to move in the direction of being paid at a higher rate or becoming licensed, or even though I recognize that many license-exempt providers will not ever want to become licensed or become licensed. But we should try as much as possible to coordinate those systems and move in that direction.
Hi, Kate Miller with Children Now, and I'll just make some top-line higher-level comments, and echoing much of what's been said here already. We encourage CDE and Department of Social Services and other agencies that are involved in this conversation to really approach the inspections process more not as a measure of compliance, but rather as a first step in a provider's pathway to quality and resources, or a step in that direction. And that's been echoed here today, loud and clear. And for that matter, even the pre-service requirements, thinking about the orientation requirement that's being looked at as well, just again, thinking of that as a bigger opportunity for this population, particularly for the license-exempt population. We really feel this is a critical opportunity for engagement. It's more than just an inspection, as has been said. It's really important that we think about a strength-based model. We echo that sentiment, and have also thought the home visiting model could work. We need to consider entities and professionals that are experienced with the needs of this population to really think about the implementation piece. Given that these will actually be required, that we do have to figure out how to do these inspections, we really think the state could maximize the opportunity to provide resources and technical assistance, and that technical assistance piece is huge, the potential coaching or sort of a home visit model going above and beyond just brochures and more information that folks don't read, but really sort of providing some of that on-hand support. And beyond just the health and safety topics as well, we'd like to see something around child development, social emotional health, even could consider trauma-informed care information, you know, how to meet the needs of more vulnerable populations, thinking about our foster care children. So I really think there is this potential there to build on that sort of the base resources that would be covered, but really think broader and think longer term about what our children and what our providers are needing to really support children today in California. We'd also echo the sentiment about building on existing infrastructure, loud and clear, and again, proven models that we know, as mentioned, the R&R, APPs. We have experience in this, and we really need to draw on it, not start from scratch. We also wanted to note that we think once this sort of system is put in place, we'll have this incredibly rich data that might be available to us if we're actually doing these visits and meeting providers where they're at in their homes. We really would like to see a system put in place for gathering that data, for really being able to utilize it, and over time, you know, use it to develop strategies to better support our license-exempt providers and our families as well that need information in our in this system. And finally, I would just say we are concerned, of course, about the funding for this. Would really like to encourage this to be additional funding out of general fund, not to take away from our current child care slots, from our current, as we know, the system is extremely taxed already. And we also would like to see that it's not that our quality improvement set aside is not used just to meet these licensing requirements. We see that system, that chunk of money is also very taxed as well already, and we don't want to be taking away from those resources to meet this requirement.
Thank you. Is there anyone else from Marin that would like to provide comment?
I think that's everyone.
Thank you. Anyone else across the state? If you haven't already, please send us a note if you have any additional commenters in the room. It looks like we've heard from everyone. There are no additional commenters. We want to thank everyone for your participation today. Again, if you have specific comments, you're welcome to send them at any time to the information provided on our website. We have one session left today on professional development, and that session will begin at 2 o'clock. So please feel free to join us then. And for those of you that are hosts, feel free to either hang up and call us back, or you can also stay connected through this whole period of time. Thank you again. Have a good morning.
Thank you.